All right, everybody, welcome back to the Fast Times News.
It's deep dive time.
Yes, it is. And today we're diving into something that's causing a lot of waves. It's this whole thing with Donald Trump nominating Robert F. Kennedy Jr. to head the U.S. Department of Health and Human Services.
Yeah, this is a big one.
It is a big one. And you know, we talk about a lot of political stuff here, but this one really hits home for a lot of people.
Absolutely, because we're talking about potential changes to health policy, things that could directly affect all of us.
Exactly. So we're going to break it down. We're going to talk about who RFK Jr. is, what his background is, what he's known for.
And why this nomination is raising so many eyebrows, let's be honest.
Yeah, for sure. I mean, the guy's a Kennedy, right? Like, that's a name that carries a lot of weight.
Huge political legacy.
Right. But he's also been very outspoken about some pretty controversial health theories.
Let's put it mildly.
Yeah, so let's start there. Like, for people who might not be super familiar with RFK Jr., can you give us like a quick rundown of his background?
Sure. So as you mentioned, he's a Kennedy, part of that famous political dynasty.
Right.
But he's made a name for himself as an environmental lawyer.
Okay.
Very passionate about that. Actually done some really important work on that front.
Right. I've heard that.
But then there's this whole other side to him, the one that's really stirring things up right now.
Yeah.
He's been for years promoting these theories about vaccines and autism, and those have been pretty thoroughly debunked by the scientific community.
Okay, so we're talking like legit scientists, researchers who've looked at the data and said, no, this isn't holding up.
Exactly. Mountains of evidence to the contrary.
And yet he's still out there advocating for these ideas.
Which is why so many people are concerned about him potentially leading the organization responsible for public health in the entire country.
Yeah, I mean, it seems like a pretty big conflict of interest, right?
That's putting it lightly.
Okay, so Trump nominated him. Why did he pick this guy out of all people?
Well, according to Trump himself, he wants to protect Americans from what he calls harmful chemicals and misleading information. And specifically, he's talking about pharmaceutical companies.
Okay. I mean, I can see how some people would agree with that sentiment, right? Like big pharma. They do have a lot of power.
For sure, there are valid concerns about pharmaceutical influence.
Yeah.
But Kennedy's approach to addressing those concerns is, well, let's just say it's not exactly mainstream.
Yeah, I think we've established that. So, okay, so you've got people on one side who are worried about Kennedy's views.
And then you've got people on the other side who seem to really resonate with his message.
Right, like what is it about his message that appeals to certain segments of the population?
That's a really interesting question. I think part of it is that he's tapping into this existing anxiety about corporate influence in healthcare.
Right, like people are already kind of suspicious of big pharma.
Exactly, and Kennedy is feeding into that suspicion. He's basically saying, I'm here to fight for the little guy against these powerful corporations.
And that message probably resonates with people who feel like they've been let down by the healthcare system in some way.
Absolutely, especially people who feel like they've been harmed by certain medications or who distrust conventional medicine in general.
So it's not necessarily that they agree with all of Kennedy's claims, but they see him as someone who's challenging the status quo.
Exactly. And that can be very appealing to people who feel like the system isn't working for them.
Okay, so let's talk about the reaction to this nomination, because I know it's been pretty heated.
Oh, yeah. It's been all over the news and social media. There's been a lot of pushback from Democrats and even some Republicans.
Okay, so not just a partisan thing.
Not at all. I mean, one of the most vocal critics has been Senator Patty Murray.
She's a Democrat, right?
Yeah, from Washington.
Yeah.
She's a ranking member of the Health, Education, Labor, and Pensions Committee.
Okay, so she's got a lot of say in this.
Exactly. And she's expressed serious concerns about Kennedy's nomination, saying it could set back decades of progress in public health.
Pretty strong statement.
It is. She's basically saying that his views could actually endanger people's health.
Okay, and what about Senator Bill Cassidy? He's a Republican, right?
Yeah, he's from Louisiana, and he's also a physician.
Okay, so he's coming at this from a medical perspective.
Right, and he's been a little more cautious. He's said that he wants to hear more from Kennedy directly before forming a judgment.
So he's not ruling him out completely, but he's got some reservations?
Exactly. He wants to make sure that Kennedy's views align with what's best for public health.
Okay, so this whole confirmation process, what does that actually look like? Like, what are the steps involved?
Well, first, the Senate holds hearings where the nominee testifies and answers questions from senators.
Okay, so it's a chance for them to grill him a little bit.
Exactly. They want to get a better understanding of his qualifications, his experience, and his stances on key issues.
And then if the committee approves the nomination, it goes to the full Senate for a vote.
Right. And given the controversy surrounding Kennedy, this confirmation process is going to be anything but smooth sailing.
Yeah, I can imagine. Okay, so let's say he does get confirmed. What could that actually mean for public health policy in the U.S.?
That's the million-dollar question, right? And it's hard to say for sure, but there are a few areas where we could see some pretty significant changes.
Okay, like what?
Well, one area that immediately comes to mind is vaccination.
Right, because he's been a vocal critic of the current vaccine schedules.
Exactly. And if he's in charge of HHS, he could potentially push for changes to those policies.
So we're talking about like altering the recommended vaccine schedule for children.
Potentially, yes, which could have a huge impact on disease prevention and public health.
Yeah, that's a big deal.
And then there's the whole issue of pandemic preparedness.
Okay, and what exactly falls under that umbrella?
Well, we're talking about things like stockpiling essential medical supplies, developing a rapid response strategies for new outbreaks, and coordinating with international health organizations.
Okay, so basically making sure we're ready for the next pandemic.
Exactly. And Kennedy's skepticism of mainstream medical approaches could lead to some pretty drastic shifts in how we prepare for pandemics.
Like what kind of shifts are we talking about?
Well, for example, he might prioritize alternative treatments over traditional ones, or he might be less inclined to invest in things like vaccine development.
And that could have some pretty serious consequences.
Absolutely. We could be less prepared for the next pandemic if we're not following the best available science.
Okay, so it sounds like this nomination is raising a lot of questions about the future of U.S. health policy.
It definitely is. It's a story we're going to be following very closely here at the Fast Times News.
Yeah, for sure. We'll keep everyone updated as things develop.
It really makes you think, though, doesn't it? Like, what happens when personal beliefs clash with scientific consensus?
Yeah, like how do we balance individual freedom with the need to protect public health?
And what does this whole situation say about the current state of trust in scientific institutions?
That's a big one.
Huge food for thought.
All right, everyone. Thanks for tuning in to the Fast Times News for this deep dive.
Make sure to like and subscribe so you don't miss any updates on this developing story.
We're going to be keeping a close eye on this one, and we'll break it all down for you right here. So stay tuned.
Until next time.
See ya.